Hemophilia C is a type of bleeding disorder caused by a deficiency of the blood clotting factor 11. In this mnemonic video, we'll give you an easy way to remember all the key facts about hemophilia C, so you'll be ready come test day. This guy was looking forward to taking a break from studying and unwinding with a movie, but these copyrights make streaming pretty annoying. This guy even lost his temper and banged his hand on his laptop, cutting his hand and getting blood everywhere. The copyright C and bleeding together will serve as your memory anchor to hemophilia C. Get it? Copyright and bleeding for hemophilia C? Hemophilia C is one of 3 types of bleeding disorders. We sort these types based on which clotting factor the patient is deficient in. More on that soon. This guy was planning on watching his all-time favorite film, Ocean's 11. This big 11 on the title screen should help you remember factor 11 deficiency. Get it? Ocean's 11 for factor 11? Factor 11 is a blood clotting protein that circulates in the bloodstream. Factor 11 is a clotting factor that works in the intrinsic coagulation pathway to cause the formation of blood clots in response to injury. Deficiency of factor 11 can inhibit the intrinsic pathway, which prevents the formation of blood clots. This inability to clot then leads to the bleeding characteristics of all hemophilias. While it's easy to reason that hemophilias result from clotting factor deficiencies, it's hard to remember what letter disease goes with which clotting factor. This Ocean's 11 movie being copyrighted with a big C should help you remember that hemophilia C goes with factor 11 deficiency. After getting injured in his frustration, our guy here has decided to do the right thing and just buy the movie. See that small cart icon on the screen? By the way, a small cart is our recurring symbol for autosomal recessive inheritance. Since carts with wheels are a type of auto, and a cart is a small and unintimidating vehicle, or recessive auto, if you will. This should help you remember that hemophilia C is inherited in an autosomal recessive manner. It's important to contrast this with hemophilia A and B, which are both X-linked recessive disorders. Practically, this means that hemophilia C is not only rare, but it also affects roughly equal amounts of men and women. Next, notice all this bleeding. As a disorder caused by deficient blood clotting, you should be able to reason that hemophilia C causes bleeding. I mean, it's right in the name, hemophilia. Heme means blood, while philia means to like or love. Therefore, hemophilia literally translates to people who love blood or bleeding. This said, I want to mention that the bleeding caused by hemophilia C is relatively mild compared to that of other hemophilias. In fact, most patients don't even know that they have this disease until they have some traumatic accident or surgery, during which bleeding that is more severe than normal is noticed. So what laboratory results do patients with hemophilia C exhibit? Shift your gaze to the overflowing bag of potato chips. Snacks are obviously essential for movie night, and potato chips are my go-to. All these potatoes should help you remember elevated PTT. Get it? Since potato is obviously an acronym for PTT, right? Well, actually, PTT stands for partial thromboplastin time, a lab test measuring how long it takes for the blood to clot. And just like these potatoes are overflowing, the PTT is elevated or increased in patients with hemophilia C. Specifically, the PTT measures the function of the intrinsic coagulation pathway, which is inhibited by a deficiency of factor 11. The time to form a clot is obviously going to be increased, so it should make sense that PTT would increase. Besides PTT, patients can also be tested for levels of PT. That's only one T, folks, which stands for prothrombin time. Unlike PTT, which measures the function of the intrinsic pathway, a PT test mainly measures the function of the extrinsic pathway, which is not affected by factor 11 deficiency. Therefore, PT levels are unaffected or normal in hemophilia C patients. These patients also have a normal or unaffected bleeding time, since bleeding time measures the time it takes to form a platelet plug rather than a blood clot. And the platelet plug is basically unrelated to factor 11, so this is obviously not affected by hemophilia C. We didn't symbolize these two tests since the levels are normal or not affected. It would be really confusing if we symbolize something that is not found, right? Before we end the video, let's briefly discuss treatment. This is really easy. Patients with severe hemophilia C usually just get this clotting factor replaced as recombinant factor 11 concentrate. Give factor 11 to replace deficient factor 11. I'm no Einstein, but this seems pretty straightforward to me. Alright, that's all for this mnemonic. Let's recap what we've learned. Hemophilia C is an autosomal recessive inherited bleeding disorder caused by a deficiency in clotting factor 11. Like most hemophilias, patients with hemophilia C present with symptoms of bleeding. This bleeding is usually milder than what is seen in other hemophilias. The diagnosis of hemophilia C can be supplemented by the lab finding of an elevated PTT. And now we're actually done with hemophilia C. Please don't pirate our content like this guy, by the way. It's really unfair to our tiny team of people who literally put in thousands of hours to bring you the best content in medical education. If you like this video and want to see more content like this, please support our team by watching at Pixorize.com. See you in the next video.